Okay, so the next question that was I was asked to answer was the emergency response and critical thinking. So there's a couple of questions under this. So the first one is, what are your initial steps you should take when responding to a medical emergency? Well, the first thing I would say is ABCDE. Simple as that. Basic first aid. That's where everyone starts, even nurses and doctors in hospitals. We all start with basic first aid, ABCDE, and everything else leads from that. The only difference within hospitals and out in the community is that each of these individual sections we can expand on with more equipment, more treatment, and more life-saving approaches, but the basic principle is still the same. So responding to a medical emergency requires quick thinking, calmness, and an organized approach to ensure the safety of the patient. So as I said, simply use ABC. So A for airways. Okay, so making sure that examination of the airway, making sure there's no noises, the position of the head, there's no foreign bodies or fluid or secretions, no swelling. Is the airway, is air going in and out of the airway? So you might need to open. Obviously in hospital, you would then suction, secure the airway if necessary. And that could be with a simple airway, or, if you've got someone practicing, an ET tube can be passed, and obviously given oxygen, piped oxygen would be the outcome. So the goal is bait and airway. That's the idea. B, breathing. So again, listen, look, listen, feel, look and listen. What can you see? What can you hear? What's the respiratory rate and effort? Breathing and added, is there breathing sounds or obstruction, sounds of obstruction? Is there bubbling from the mouth and things like that coming up from the lungs? Chest movements, are they symmetric up and down? Tracheal deviation, is the trachea at the top moving to one side? Again, the jugular vein, is that distended? Are they blue and things like that? So again, oxygen. Okay, oxygen sometimes has been described as the champagne of life. Okay, so you must have it. So pneumothorax therapy, inhalation therapy, and ventilation. So all these added things will be happening in the hospital, again, to keep the ventilation. C, heart rate. So checking the heart rate, checking the blood pressure, capillary refill time. Is there any bleeding that's causing a problem with the circulation? Skin color, pallor, cyanosis. And again, hospital things like blood samples and things like that. And you'd have IV access, control the bleeding, fluids, medication, transfusion, and things like that. And then D, which is diagnosis. So again, things like that's where your Glasgow Coma Scale comes in, AFPU, pupil reactions, blood glucose levels, basic urology and examination, posture, and again, things like in hospital toxicology examination. And the thing is obviously looking at glucose and any antidotes to possible poisoning or any drugs overdoses, so antidotes for that. And then finally, exposure. So head to toe examination, medical history. Again, in hospital, things like temperature, is there any injuries, edema, scars, signs of drug abuse, skin changes, signs of infection, sepsis. And again, it's obviously treating those individual conditions that are impact on the rest of the ABCD. Okay, so next thing, so basically, first thing, ABC, D, E, quite simple. Next thing is communicate clearly. So to all team members, including paramedics, provide them with clear, concise information about the situation. What interventions were performed, any observations about the patient's condition. Again, use SBAR, excellent tool for using, passing this information on. So relay key details, including the patient's initial condition, response to any interventions, medical history, and the timeline events. Now you'll get a lot of these from I say paramedics, or if you're out in the community, it might be witnesses and passers-by and things like that. And the timeline of events is very important as well for when they go into hospital, because then they can work out whether certain drugs and treatments are required, aligning with the timeline. So afterwards, it's follow up and debrief. So after the situation is under control and the patient is handed over to the appropriate medical team, participate in the debrief to review the situation. And this medical team could obviously be, if you're out in the community, you can pass it over to the paramedics, or if you're taken into hospital, it's passing over to the emergency department team, or if you're in the emergency department, handing over to specialties such as neurology or medical surgery or something like that. So, so yeah, after situational control and the patient is handed over to the appropriate medical team, participate in debrief to review the situation. This allows you to evaluate the response, identify areas for improvement, and ensure emotional support for those involved. And again, for individual nurses, is giving that, you can do your own personal reflection on this. So even in post-emergency debriefing, discuss emergency and reflect on responses for continued learning. And again, improving practice. Everything can always be improved on. And again, discussing how that situation went, you can always improve. So as we said, to be honest, most nurses are unaware of basic first aid. It's very rarely, certainly when I trained in nursing many, many years ago, we never did first aid, or we did it very, very briefly. So if anyone asked me in the street, who would I like to look after me if I had an injury in the street, my first response would be a paramedic, my second response would be a first aider, and my third response would be a nurse, and then my fourth would be a doctor. So that's my response in those orders. So I always recommend all nurses, if they're unsure about first aid, always attend a reputable and licensed course, such as those offered by St John's and the Red Cross in the UK, and St Andrews in Scotland, of course. So how do you prioritize tasks when dealing with multiple critical patients? So if you're out there, okay, well, you could be in a hospital environment, but if you're out in the community, how do you deal with all this? So when dealing with multiple critical patients, prioritizing tasks is crucial to ensure that the most urgent needs are addressed first. So while also maintaining overall patient safety, so the idea is to have a view of everyone, you must undertake your critical thinking, clinical judgment, and time management skills to prioritize care in these. So certainly in these high pressure situations. So here are key steps and strategies that you can use. So as I said before, A, B, C, D, E. Always start that off. That's always your foundation for any situation. Even if someone's cut their thumb or finger, always start off with A, B, C, D, E, just to make sure they haven't ruled out anything else. You have ruled out everything else. So start framework. Any problems related to airway, breathing or circulation should be taken precedence as they are vital to sustain life. So work your way down. So example, if one patient is experiencing respiratory distress while another has a minor wound, the patient with airway or breathing issue is always prioritized first. That's the first one you go to. Next one, triage using the severity of any condition. So use a triage approach to classify patients based on the severity and urgency of their conditions. So patients with unstable vital signs or life-threatening conditions should be attended first. So we break it down into this: emergency, so life-threatening conditions, so cardiac arrest, severe trauma, shock, respiratory failure. Urgent, so serious but not immediately life-threatening conditions such as uncontrolled pain, significant bleeding, and then non-urgent, so stable conditions with minimal risk of rapid deterioration, such as stable fractures and minor wounds. So an example is if one patient is in shock while another has chest pains but stable vitals, the patient in shock should be treated immediately focused on, because there is an underlying reason how they have that shock, probably because they're losing blood somewhere, hemodynamic shock. So assess patients. So perform quick assessments of each patient's condition to gather critical data that will inform your decisions. So using your training, your knowledge, your skills, and your critical thinking and best practice to prioritize case based on each specific patient's needs. So conduct a rapid but thorough assessment to identify changes in each patient's status. Use this information to determine which patients require immediate interventions first. Next, stable the most critical patients first. So focus on stabilizing the most critical patients to prevent further deterioration. This might include interventions like administering medication, managing pain, controlling bleeding, or providing airway support. So if one patient is actively bleeding while another experiencing pain, the patient with hemorrhage or bleeding should be stabilized first to prevent hypovolemic shock and the conditioning worsening. Don't forget, delegate tasks when appropriate. So in situation with multiple critical patients, effective delegation is essential. Delegate tasks to other nurses, nursing associates, even HCAs or other team members, especially for non-critical tasks. So you can focus on the more urgent patients' care needs. So assign stable patients or less critical tasks, e.g. routine monitoring, gathering supplies to other team members while you handle the more acute patients. Don't forget your skill mix. Utilize it always. Okay. Use time management skills. So in an environment with multiple critical patients, effective time management is key. Prioritize tasks that will stabilize the patient quickly and efficiently. Action. So basically what you need to do for patients with urgent needs, provide immediate interventions such as IV medications, then monitor them closely, but move on to the other patients once the critical issue is under control. Communication. So communicate with the healthcare team. Clear communication with doctors and other nurses and other healthcare professionals is essential. Keep the team informed about the patient status and request help when needed. Collaborative efforts improve patient outcomes and help distribute the workload more effectively. So update the healthcare team regularly on changes in patient conditions and ask for support with tasks such as intubation or blood transfusion. How do we use and what can we use to communicate with them? Yep, you got it. The S-bar tool. So next thing we could also do is document. So make sure that you document interventions and monitor changes. So accurate and timely documentation again is critical, even during high pressure situations. After attending immediate needs, documenting the interventions provided and the patient response. Continually reassess patients for any changes in condition and adjust priorities as needed. Now, quick document vital signs, medication administration, and clinical interventions as soon as you can to ensure continuity of care for each patient. Also, going forward, if there's any investigations or outcomes that need to be reviewed due to this incident, that documentation will be pivotal in that. Okay, I'll start that one again.
No
So,
problem.
document interventions and monitor changes. Accurate and timely documentation is critical, even during high pressure situations. After attending to immediate needs, document the interventions provided and the patient's response. Continually reassess patients for any changes in condition and adjust priorities as needed. So quickly document vital signs, medications administered, and any clinical intervention as soon as you can to ensure continuity of care for each patient. Also, going forward, these records are key points of information if there needs to be any further reviews or any forward incidents regarding this specific incident, okay, any further outcomes. So they will be relied upon, and they can be relied upon in a court of law as well. Anticipate potential complications. So experienced nurses anticipate complications based on patient condition and prepare accordingly. For example, a patient with chest pain may deteriorate quickly, so preparing medications or equipment in advance can save time and improve outcomes. So if a patient is at risk of cardiac arrest, ensure the emergency equipment, defibrillator, etc. is nearby and ready to use. Stay calm and organized. So staying calm under pressure allows you to think clearly and prioritize effectively. Using structured approaches like checklists, algorithms, or mental rehearsals can help manage the chaos of multiple critical patients. Keep tracks of each patient's status mentally or by using visual tools like a whiteboard to track priorities. So take a deep breath and keep focus on task at a time to avoid feeling overwhelmed. If needed, briefly step back to reassess your priorities, ensure nothing is overlooked. So what I have done previously myself in lots of occasions is taking a couple of seconds time out, which can refocus you and save lives. So simplest thing I've done quite numerous times when giving out medication, I've gone up to the person and just before they're given the medication, I stop there for at least 2 seconds and just think, what am I doing? Am I happy what I'm doing? And if I have ever any doubts, then I'll go back and re-examine what medication I'm giving. So it's always good just to 2 seconds time out. It's only a couple of seconds, but it could make all the difference. And the other thing about being calm, it's not necessarily being calm yourself, but it's always give the appearance of being calm, as this will help others. This will help reduce panic in them and help instill confidence and calmness in them. If you are internally, uh, try and control your calm internally. As I said, after it's all over, you can go and sit in a corner and panic all you want, okay? Which is what I do tend to do. So when it's all over, store that panic up and release it later on. What role does teamwork play in an effective emergency response? So teamwork is essential in an effective emergency response as it ensures that critical tasks are executed quickly, efficiently and safely. So in high stress situation, no single individual can manage every aspect of care. That's ridiculous to ask. So it needs to be a well coordinated team can leverage the expertise and strength of each member, optimizing patient outcomes, enhancing the overall quality of care. So here the key role teamwork plays in an emergency response. So the first of all, division of skills. So in an emergency, time is of the essence, as we know, and there are often multiple tasks that need to be addressed simultaneously. So effective teamwork allows division of responsibilities so that life-saving interventions can occur rapidly without delay. So team members can be assigned specific roles such as airway management, chest compressions, administration of medications, or documenting interventions, ensure that all critical tasks are covered without overlap or confusion. So, but obviously you need to make sure these roles should be assigned before the emergency is underway, so everyone knows their place, okay, and what part they're playing. Communication and coordination. So clear, concise communication is the backbone of any emergency response. Team members need to relay information quickly and accurately to ensure everyone is on the same page. This includes updates on patient needed interventions, any changes in their condition, and also it as well, any decisions made need to be made as a team decision as well. So teams should use structured communications tools like SBAR to communicate effectively, closed loop communication where the message is repeated back for confirmation. Now that's something that I've used a lot, certainly within trauma situations, resuscitation situations. This helps prevent misunderstanding. Share expertise and skill sets. So in a multidisciplinary team, each member brings a unique skill set that contributes to the overall effectiveness of the response. Doctors, nurses, anaesthetists, and other healthcare professionals that collaborate using their specific expertise to address different aspects of patient care. So an example of that, for example, is a nurse manages medication administration and monitors vital signs or observations. This might focus on securing the airway, and a doctor might lead decision making based on the patient's overall condition. Adaptability and flexibility is key. So emergency situations are dynamic and can change rapidly. Team need to be flexible with members ready to adjust their roles or responsibilities based on the evolving needs of the patient. A collaborative team environment encourages adaptability and allows members to step in where needed. So if one team member is overwhelmed with a critical task, others can shift focus to help without waiting for direction. For instance, if a nurse handling CPR becomes fatigued, another team member should be prepared to take over chest compressions. Effective use of time. So a well-coordinated team minimizes delays and maximizes use of time, with multiple team members handling different aspects of care simultaneously. Critical interventions such as CPI, defibrillation, medication administration, and area management can occur in parallel. So time-sensitive actions like administering of adrenaline or epinephrine, or using an automated or decompressions or defibrillator can be performed quickly by designated team members without waiting for one task to completed by another one begins. So it's a constant, smooth ongoing of parallel tasks that are carried out. Reduction in errors. So in high stress emergency, mistakes can and do happen. Teamwork help reduce the likelihood of errors by distributing the cognitive load, enabling team members to cross-check each other's actions. A collaborative environment encourages double-checking interventions, especially in high-stress scenarios. A nurse preparing a medication might verbally confirm the dosage with another team member before administering it, preventing potential errors in high-pressure situations. And again, this is where sort of a debrief and feedback is great afterwards as well. Emotional support and stress reduction. So emergency situations can be overwhelming and stressful. Effective teamwork provides emotional and psychological support for team members, which helps them remain focused and calm. Knowing the colleagues are working together towards the same goal can alleviate individual stress and improve collective performance. The team members can offer encouragement, debrief after critical moments, and help manage emotional responses during and after emergency, which support overall well-being and reduces burnout. Leadership and decision making. So strong leaders crucial in guiding the team's actions and making quick decisions in an emergency. The team leader provides direction, delegates tasks, and ensures that team stays focused on a priority Actions needed to stabilize the patient. Good teamwork involves recognizing and supporting the team leader while also contributing input when necessary. So in an emergency situation, a doctor or team leader might assign tasks such as intubation, defibrillation, and medication administration while maintaining overview of the patient's condition and directing the overall strategy. Now, the team member doesn't have to be a doctor. The team member is assigned usually on the day of the shift, who would be a team led in emergency. And they're going out in the community. It's someone that steps forward and leads the team. So it doesn't have to be a doctor. Shared accountability. So teamwork fosters a sense of shared responsibility for the patient outcome. Every team member plays a role in the success of the emergency response. Knowing that each member is accountable helps everyone stay committed and to performing at their best. So all team members feel equally responsible for patient care, leading to collaborative effort to improve the patient condition rather than relying solely on one person's judgment and actions. So again, at the end of the day, if there is any hard decisions to make, whether to carry on resuscitation, that won't be one person's individual decision. That will be a group decision, and all have to be unanimous. Don't feel isolated, and it helps you not to feel isolated in your responsibility. Post-emergency briefing and continuous improvement, which I have touched on. So after the emergency has been managed, teamwork plays a vital role in debriefing and reflecting on the events. Teams that work well together can provide feedback on what went well, what could be improved, and how future responses can be made more effective. Continuous learning process helps improve future responses, enhances team performance. So after the emergency, team members gather to discuss the situation, share insights, and identify areas of improvement in communication, coordination, and clinical interventions. So here's a brief example of effective teamwork in an emergency. So it's in a cardiac arrest situation. So generally the senior doctor or even a senior nurse on duty usually leads the team making clinical decisions about interventions. Both nurses and doctors are responsible for administration of medications, performing chest compressions and monitoring observations. Anaesthetist or another team doctor manages the airway and provides ventilation. Nurses or nursing associates ensure that medication and necessary equipment are readily available. Again, HCAs can also assist with this. Documentation. This is the ongoing documentation during the incident. This is done by nurses, nursing associates, and even HCAs trained in this role um, can record the events as they unfold, ensuring that all actions, including medications given and patient responses, are tracked. Each team member knows their role, communicates clearly, and works towards a sharing goal of saving the patient's life. Thank you.